Field epidemiology has shown its value for many decades, in fact, probably into the last century. The value of field epidemiology is to answer important community threats, population-based threats early on, identify them, and stop them, eliminate them as a problem, and thus improve the health of the population. And it's true for a myriad of infectious diseases, but it also works for everything from violence to environmental hazards, to reactions to toxic substances. So it's a proven, practical, cost-effective technique that makes a big difference in the health of communities. There are a few critical issues attached to field epidemiology today. One, there's just lots of things going around, and for people to get their attention and get them to focus on the importance of any one of them, there's a lot of competition. Having said that, we have a good story to tell in field epidemiology. We have problems that we've dealt with, challenges we've met, and it's a compelling story to the population at large when well told. So I think our challenges are, number one, to be seen as relevant to the communities and where we live, that it requires our work, our help, and that they respect us for it and they value what we do. That in turn leads to increased support, including financial and thus sustainability over a long term. And a second key area, I think, for FETPs is documenting their value. In other words, to do an evaluation of what's going on. So we're able to say, we just don't think these are good things. We know they're good things because we've shown that the time period of controlling them is much faster when you have a trained field epidemiology cohort of workers. There are multiple measures of this, but the challenge to us is to get them down and get people to hear about them and learn about how more quickly these epidemics get identified, addressed, controlled, and then prevented in the future. And that's a story we can tell. This conference is striking, and I was surprised at the incredibly large turnout of people from countries all over the world. And some of the folks here are new to this area of field epidemiology, and many of them have been doing it for some time and are well practiced and quite sophisticated in it. And to see such a large group get together, sharing common interest, reinforcing the value of what each other does, is very heartwarming, and I think it's great.